So thank you for being here tonight for this webinar Wednesday. Today's topic is MS fatigue, why you are more than just tired. This webinar series is brought to you by Can Do MS, and my name is Krista Sipp. I'm the Director of Programs here at Can Do, and I'll be your moderator this evening. I want to take a brief moment to thank our generous sponsors for supporting this webinar series. Thank you to Genentech, Viatris, and E&D Serona for their support. I'm very excited to welcome our speakers tonight. We have Dr. Stephanie Buxhoveden and Dr. Derek Robertson. Welcome. Stephanie's an MS nurse practitioner, a MS researcher, and she also lives with MS. And she's the Chief Scientific Officer at the Accelerated Cure Project for MS. Additionally, she's the host of our Can Do MS podcast, so maybe some of you have heard from her there as well. And then Derek is a neurologist, and he's also the director of the Multiple Sclerosis Division at the University of South Florida, where he works. So welcome tonight, Stephanie and Derek. Thank you guys for being here and sharing your knowledge and perspective with us. Without further ado, I'm going to hand things off to Stephanie to introduce our learning objectives tonight.
Absolutely. Thank you all for being here. Tonight, we're going to learn about MS fatigue. So hopefully that's why you're interested in attending. We're going to understand the factors that contribute to your fatigue, and we're going to learn ways and other aspects of wellness that can contribute to either improving your fatigue or help with sleep management. So what is MS fatigue? So the definition of fatigue, it's a subjective lack of physical or mental energy that's perceived by the individual or the caregiver to interfere with the usual or desired activities. So it occurs in most people with MS, and it's often rated as the worst symptom. It can come on suddenly and often occurs even after a good night's sleep. Heat and humidity can aggravate it, and it can be associated with physical, emotional, and mental exhaustion. So I think now's a great time to turn it over to Derek, our neurologist and our specialist, to give an overview.
Well, thanks. And again, I really appreciate the opportunity to hang out with you tonight, Stephanie, and Krista. Thanks for organizing. So we talk about this a lot in clinic, right? Right, Stephanie? Like, this is a incredibly common, and who am I talking to? There's hundreds of people on this call that live with it. So it's going to come across a little preachy, and I apologize. But I think to zoom out and think about the scientific rationale why this happens is so incredibly important, because when I'm hanging out with my favorite people in the world, my patients in the clinic, and we're working through kind of why this is happening to them, because it's a big one. Like Stephanie just taught us, like this dominates clinic conversations. The therapies for MS that prevent relapses work so darn well these days that they often are doing such a good job at preventing relapses. That's freed up a lot of time over the last, gosh, almost probably decade now, where I feel like we've been able to actually start to focus more as a community on helping you all, helping our patients with the kind of day-to-day grind of living with MS, since I think we're doing such a better job of actually preventing the acute damage that can happen. And this is a big one. So kind of what drives primary MS fatigue? Well, it's very biologically complex. And there's a cartoon on a slide in just a second that I created that I think tries to get at kind of like a zoomed in, almost like biochemistry lecture. It's actually the same slide that I show when we were making it, same one I show our medical students. Like, it's that into the weeds. There's these things called cytokines. It's how our immune cells talk to each other. But when they're amplified, it can slow down nerve processing speed. So that's what nerve conduction speed it talks about. So when this inflammatory response called cytokines ramps up in our brain, and an MS patient's brain, unfortunately, can kind of live in this kind of chronically mild but chronically inflamed state, nerve speeds slow down. And one of the ways a patient's experience is they use up all their energy demand and they feel tired. And it could be, to Stephanie's point that she just went over, it could be a mental exhaustion. It could be a motor exhaustion. You could just feel drained physically. And it's actually, at least in part, if it's primary MS fatigue, and I'll make that distinction a little more in a second, this is in part the rationale why and I don't have to tell anybody on this call, always gets worse. Like one of the worst places to have MS is Florida, from the month of, I don't know, March, all the way to like October, where it's like constantly 100 degrees and patients feel worse. There's a very clear seasonal component to primary MS fatigue because of this aggravating effect on the symptoms of MS, not the actual underlying disease. Next slide, please. So this is always controversial, but I wonder if we know between men and women who has bigger brains. So I know this isn't like we could talk back and forth, but I hate to admit it because we waste it, but men have bigger brains than women by about 10%. A lot of it is like just the physical skull size, and then we fill in the extra size with our brain. So men have bigger brains than women. That's passive brain reserve. Women have much better cognitive reserve, like the thing that actually matters. So that's the ability to be flexible and efficient and use our brain. So it's the neural hardware and the neural software. So the hardware is the size. We got you beat, ladies, but women do a much better job with their actual software. So kind of knowing that this is our starting place with neurologic reserve, and then to layer on the fact that patients can have MS, like those on the meeting that have it, these are the things we think about and how to prevent this reserve from dwindling. And so this idea behind the two, I think, matters because there's things that we can do about it. So before we talk specifically about fatigue, I wanted to spend just a brief moment knowing that the thing that we worry about the most is what we can control. And that's that guy on the right. So the education, things like educational attainment, what line of work that you do, what do you do in your free time, things like cognitive exercises. Stephanie will unpack that a little bit in a few slides downstream. There are ways to kind of build up your cognitive reserve that has a downstream benefit on improving those neural connections and indirectly helping with something like primary fatigue. So there are non-medication ways to actually keep our cognitive reserve high and to, in part, keep our fatigue levels down. And we have a whole strategy slides upcoming that kind of talk through that. Okay, so this is that cartoon I was talking about. So this is taking a brain, slicing it right in half. If anybody's ever looked at their MRIs with their neurologist, wherever in the world you are, this will kind of look like an MRI. And so these connections from the surface of our brain, we're looking at the cartoon off to the right. So these connections from the surface of our brain to these deep middle structures of our brains are called the cortico-subcortical connections. So why does that matter? That matters is because how nerves talk to each other is through chemicals, things that I'm sure that we've heard of, but I'll say them out loud. So things like serotonin, dopamine, adrenaline. So these are neurochemicals that live in our brain and help create fast and tight connections between these nerves. So unfortunately, the disease of MS loves to disrupt these cortico-subcortical connections. So how does that manifest? That manifests predominantly in two ways. A patient feels that gradual slowing or that disconnection by feeling mental cloudiness, so kind of the multitasking difficulties and some of the cognitive slips that MS patients get, predominantly with like the tip of the tongue phenomena, like you know the word that you want to say and it's kind of stuck, or you're trying to do you're making dinner, you're letting the dog outside, you're making coffee in the morning and the poor dog gets left outside and you leave the coffee pot on because multitasking was so difficult. This is the problem, is that these connections from the surface of our brain to the deep middle parts, the autopilot of some MS patients gets disturbed. So that's one thing, is cognitive slowing. The other thing is fatigue. And so when those connections are thrown off, that's the two ways predominantly patients feel it in the short term, but really over the kind of life of having MS. And I made it not overly simplistic, but it's more layered than that. So tucked to the bottom of the slide are those cytokines again. That's how that creates that inflammatory environment. That's what cytokines means. Sleep's a big one. There's a whole slide on it in just a second where we unpack that. The overlay of mental health with respect to fatigue. When somebody starts to feel down, and I hate the term depression, but when your mood's off, you feel tired, you feel fatigued. It's actually one of the hallmark signs of depression. And so teasing out the difference between the two, the interconnectivity of it all, when somebody has depression, their serotonin levels are down. Some of the treatments we use to help when patients are feeling depressed is to boost their serotonin. And that's what MS patients are often up against is they're running slightly deficient in one or two or three of those neurochemicals, dopamine or adrenaline or serotonin. Those levels can be slightly decreased. So next slide. All right, so we talked about a little bit about this, but this is just kind of a bullet point format. So sleep-related disorders. Our brain gets the best reboot when we enter good quality and quantity sleep every night. And so that magic number that I'm sure we've all heard about, getting a good 6 to 8 hours of sleep, that does not come from nowhere. Where that comes from is the cycling. Our brain, about every 90 minutes or so, kind of cycles in and out of these deep sleep. And you need to do about 6 cycles to get kind of a full cognitive rest of good deep sleep. And if you're not, then you're going to feel tired the next day. And if you have MS, it's going to be even more amplified. That kind of baseline fatigue you might already have can definitely get worse if we're having difficulties with sleep. So if you're getting up a million times a night to pee and you have urinary frequency, that's going to fragment your sleep. If you have nerve pain and muscle pain, and every time you roll over, your leg stiffens and that wakes you up, that's fragmenting your sleep. And so these things, I think correctly, are all interconnected. And the downstream damage that happens is the next day you feel even more tired or even more fatigued than you should. And then me and Stephanie mess you up when we prescribe medications and they have side effects and they make you cognitively slow. Or so kind of guarding against all that is kind of our job when we're trying to help work through the difficulties of fatigue with you all, is to see which one of these can we affect change and which one is the biggest contributor. Because then the treatment strategies that her and I or your docs back home would come up with are tailored to what's contributing the most. All right, next slide. And then who helps with all this? And so this was disrespectful. I should have put the neurology team in the middle. So a neurologist, a physician like myself, I think we're very adept. And as Stephanie, nurse practitioners, I work with two awesome PAs back home here in Tampa, seeing MS patients. So I think your neurology team are probably the best equipped to accurately kind of diagnose the fatigue and come up with a kind of a treatment strategy. But we might rely heavily on our allied health professional colleagues, like getting you in with physical therapy. Stephanie will teach us that in a second. Working with your primary care doctors if they've well-intentioned start you on a medicine that maybe is amplifying your fatigue, and we help to figure it out. Getting you to a mental health provider if you're feeling depressed and anxious, and working through that to see how much it's contributing. We talked about pain, we talked about sleep-related problems. So there's not a one-size-fits-all approach for fatigue. And it's job employment for me, because it is by far and away one of the most common topics we talk about in the MS clinics. All right, next slide. All right, so I'm a big algorithm guy. So when I'm teaching medical students and docs in training back home, I think the best thing that teaches, and sometimes algorithms fall apart and they stink and they don't work. This is one of the ones I think where they do. And so when we're teaching our docs back home kind of how to work through this with patients, what questions to ask, what pathway to go down. I know this slide's busy and I'm sorry, but I think it's a good one because it starts with, what does the patient say? They'll say something along the lines of they feel tired or their energy isn't what it used to be. And that's a very broad thing that a doctor hears or a nurse practitioner hears. And then we got to figure out which direction to go. So we might quiz you further about your sleep patterns and what good sleep hygiene looks like and how that's working. And then we screen you for sleep. So we're working down the left side. So we might screen you for a sleep disorder. Oh, maybe you need to see the sleep specialist. If that gets treated and then your fatigue persists, well, then maybe it's your MS. So there's not a way to prove it's MS related fatigue. And then it's frustrating. It's frustrating for us too, by the way. But that's the reason for the algorithm, is that you have to kind of rule out other treatable things. And if what we're left with is things are a lot better. You're sleeping better, your mood's better. That's working down the right side of the algorithm. Then we kind of get into specific treatments for MS-related fatigue. And so again, we'll unpack that in a few slides, but kind of going down this algorithm and then ending up in the middle is where we would usher patients and figure out where they're moving with this approach. All right, next slide, please. Okay, medications can help. We absolutely have treatments for MS-related fatigue, but they don't always work, and they're not always appropriate. And again, working through that algorithm to see what types of treatments work and which ones make the most sense, medication treatments anyway, absolutely true. If it's primary MS fatigue, sometimes patients are good candidates for medications. There's pros and cons. There's some studies that are supportive of it. There's some that the results are mixed. Just anecdotally with our patients, like, treating a lot of patients over years now with MS-related fatigue, they work. They don't work in everybody, and there's not a one-size-fits-all medicine that helps. But here's some examples where if it is something we can try and then we monitor for improvement, these two right here are probably, or three are the most common ones we use. And it goes back to that first cartoon I showed about neurochemicals in the brain and what we're trying to help with. So dopamine is the wake-up chemical of our brains. So if you're like me, I'm addicted to caffeine. It's the most abused medication in the world for a reason. Caffeine works. It stimulates dopamine in our brain and it wakes our brains up. I probably drink way too much coffee, but I need to keep waking my brain up. These medicines center around that same kind of thought process. So amantadine, it's been around for decades, pretty good therapy. It can boost dopamine a little bit, and that's how we think it has the potential to help with some patients' MS-related fatigue. Like anything, medications can have side effects. This one can cause nausea and lightheadedness. A peculiar one called dry mouth. When patients start on it, can sometimes worsen some confusion if someone already has some like baseline confusion. Other ones would be like modafinil, or it's also called Provigil, or armodafinil is called Nuvigil. These ones are generic, been around for years, that we can help patients. They work kind of the same. So they help boost dopamine levels in the brain through a different mechanism. They also have potential side effects. They can decrease your appetite, cause headache, they can cause nausea. So we have to kind of start low and go slow. But this is some of the medicines that we use that can actually help some patients if we've ruled out other contributing factors. Next slide, please. All right, and so the last two kind of classes of medicines are pretty uncommon. I gave them their own slide just so you guys could have heard about them. These aren't common ones we use, but methylphenidate, it's also called Ritalin, and there's a bunch of different versions of it, and long-acting and short-acting. But they, again, the commonality here is these types of medicines, methylphenidate, they can boost dopamine, and then this one also can boost norepinephrine. Norepinephrine is adrenaline, so that's also kind of the wake-up, kind of helping connect the nerves better in our brain. Side effects with this one is loss of appetite, insomnia, headache, can sometimes cause abdominal pain when you first start on it. And then lastly, there's a class called amphetamine-based therapies. Again, pretty uncommon. We don't have a ton of patients on this, but they can work. They have some benefit in some people, and same kind of thing. They boost dopamine and norepinephrine or adrenaline, and the same type of potential side effects: loss of appetite, insomnia, headache, abdominal pain. So again, these medicines aren't for everybody. We use them, I think, in the patient scenarios where we think they could help. And then we keep asking the question at follow-ups, is it helping? And if so, with what? And we, again, go low and go slow and see if it's one of the ways we can help patients with primary MS fatigue. All right, next slide. All right, I will turn it over to Stephanie.
Thank you so much. And I love that a lot of you are putting such great tips to each other in the chat. Please keep that up, especially as I'm talking about practical things. And if you've tried something and it works, please share. And if you've found something that I haven't listed, please, by all means, this is a group effort. And I sometimes feel like you all get more out of the chat than you do from us. So good job. Keep it up. So as you all know, because you live with this, I live with this, fatigue is not something that occurs in isolation. It's one of these, what I call cycles, so symptom cycles. And when we have MS, a lot of these things occur concomitantly or at the same time, right? So let's look at fatigue. So let's say you're feeling fatigued. So the last thing you're going to want to do is get up and exercise. But when you're not exercising, that can increase your fatigue. And then again, if you're tired, you're probably not taking time to prepare good, wholesome, healthy meals. So you're more prone to picking prepackaged processed foods that maybe make your fatigue worse. And all of these things, getting less exercise, not eating healthy, can cause these other MS symptoms to worsen. You guys have mentioned bowel and bladder in the chat. I see mention of leg spasms, of nerve pain, of mood, depression. All of these things get worse when we're not taking care of our body or we're too tired to do that. And then, of course, all of these symptoms can interfere with our sleep, and then we get poor sleep, and then our fatigue increases, and so on and so on and so on. So we're not powerless in this cycle. The point I want to make to you is if you can pick one or two of these to knock out, we can break this cycle and help it better your fatigue. So let's talk about diet first. So what we know about diet and its impact. We know that obesity can worsen MS symptoms and decrease quality of life. So maintaining a healthy weight is really important. But no specific MS diet has been identified, but there's a lot of research, millions of dollars of research going into this right now. So it for sure has an impact. Some people have reported symptom improvement with special diets. These include intermittent fasting, swank, walls. We have many, many webinars and podcasts about diet. So if you're interested in a specific diet, you can turn to our resources, which Krista can provide. In general, we like to say follow a heart healthy diet, and that's because people with MS are more prone to get other issues later in life, like heart disease, like diabetes. And if you get any of those comorbidities, it can actually accelerate your MS progression. So the name of the game is trying to prevent those illnesses. And in general, we try to limit sodium, sugar, processed foods, increase fruit and veggies, choose lean proteins like chicken, turkey, fish, beans, healthy fats, and get plenty of fiber. So I am busy. I work a full-time job. I have a family, and I love to cook, but I don't always have a lot of time. So what I have done in the last over a decade of living with MS is I've come up with this system of making sure for the most part, I'm getting healthy meals that are easy. Maybe on a Sunday I go crazy, but during the week, it's all pretty much 30 minutes or less. So if I have a weekend where I don't have a lot going on, I'll go to the grocery store myself and I'll do one big shop. If I don't have the energy to spend on that, I will absolutely use curbside pickup, because oftentimes local grocery stores will offer that for free or very discounted. Walmart, Target, or delivery grocery services. I consider this an investment in myself and my energy, because if I have only so much to offer, I'm not going to spend it walking around the grocery store. Meal delivery services, also fantastic, a little pricier, but think of like any little trick here can save that much energy, and that's another 5 minutes, 10 minutes of your life you can spend doing something you really love. So also planning easy, nutrient-dense meals in advance. So look for recipes that are one pan, that use things like slow cookers or pressure cookers, because that's going to greatly reduce the time, not only the time that it takes to prepare and cook, but the time that it takes to clean, because nothing's worse than spending an hour cooking a meal and then having to spend an hour cleaning it up, and then you're exhausted, right? I also use the motto, cook once and eat twice. So double the portions and have them as leftovers or freeze for later. So by rule of thumb, at least 2 of my dinners and all of my lunches are leftovers from another big cook I did earlier in the week. I also batch cook grains, proteins, and veggies. They keep over the week very well. So I'll make a big batch of rice, a big batch of farro, any other grain. I make meatballs on the weekends, and that's easy to plop in a million different recipes. So I have chicken, beef, lamb, all sorts of fish in the freezer ready to go. Don't have to prep any protein. You just pull it out, dump it in the recipe. Same thing for veggies. If you chop a bunch up, stick them in the oven, one time in the beginning of the week, then you have fresh veggies always in your fridge that you can pull out and mix and match in different flavor profiles. If it helps save that little bit of energy, if you have dexterity problems or standing at the counter doing a lot of cutting and prepping, no shame in the game. Buy those pre-cut or frozen veggies. Same amount of nutrition, much less work. Go for it. Sit while you're prepping. Get a stool at your counter. Any little bit of energy you can save during this process is going to add up over the week. Special kitchen tools and kitchen organization is so important. So using ergonomic tools, electric gadgets like can openers, chop, anything to reduce strain. And organize your kitchen so that you're not all over the place trying to grab all of these things, right? Make sure everything you need to work at the stove is right next to the stove, so you're not having to walk across the kitchen to grab anything that you need. Next slide, please. Perfect. This is a very long slide that you can look at later. You're going to get the slides at the end. But think about what's easy to have on hand in your cabinets, in your pantry, in your refrigerator, that's healthy, easy, prepped, grab and go. And then let's talk about exercise on fatigue. Exercise can be energizing. And if you don't think so, get up, march in place, do a few jumping jacks, and you'll feel like you have a little boost of dopamine, as Derek was saying. So although it can be draining, it also can be energizing. It also helps with our other MS symptoms, right? So we know that exercise improves cognition, it improves muscle spasticity, mood, bowel and bladder function. If I'm not getting my regular exercise, and I'm guilty, a lot of weeks I'm too busy, but those weeks that I am too busy to exercise, my muscle spasticity is much worse, my mood is much worse. So we know that it impacts, and we know that part of our self-care is making time to exercise, even though we recognize it's very difficult. It also enhances our overall health, right? Again, we're trying to prevent heart disease, we're trying to prevent diabetes. And so if you have to make a choice between getting some exercise or doing something that maybe doesn't serve you, try to choose exercise. It also boosts our sleep quality. You're going to get much better sleep. And if you're getting better sleep, you're going to manage your fatigue better. And also supports our long-term wellness, right? So a couple of tips on the next one. All right, so start low, go slow, start easy, right? Like if I'm in a meeting, I work from home now, and it's been a challenge because sometimes I don't get up from my desk, but I make it a point. We get up, do a few laps around the house, get up, do a 5-minute exercise on an app, even if it's just yoga or stretching, try biking, try swimming, things that are low intensity to get started. And then once you're more in that routine of getting little tidbits of exercise throughout your day, you're going to bump up the frequency, but still keep the intensity pretty low. So we're aiming for consistency over intensity. So it's better to have a bunch of short daily sessions. It's going to be more sustainable than trying to slam an hour-long weightlifting session into your day. So try also exercising early in the day and pace yourself. So avoid doing too much too quickly. Otherwise, you're going to get burned out, you're going to get injured, then you're going to stop exercising. And then the goal is just to build gradually as your strength improves and as your endurance improves. I like to incorporate variety. I can't stand doing the same thing over and over again. So mix in stretching and balance, strength training, a little bit of everything. It's going to get you more well-rounded, more in shape, and it's going to be more fun too. It's also important to have an exercise routine that you can adapt, right? So on low energy days, I'm going to do something like stretch or yoga or go for a walk. When I have more energy to spare, that's when I'm going to do my strength training and more intense things. Also, things that are fun count as exercising. So if you like gardening, if you like dancing, I make sure that I get my play session in with my dog where we're running around with each other and we're chasing balls, and like that's exercise for me and it's exercise for them. And nothing boosts my dopamine more than like playing around with my pets. Group fitness classes, because you get that social component too. And they have so many fun active video games these days that do count as exercise. There's lots of adaptive exercises out there too, chair yoga, seated aerobics, water therapy. So we can really adapt exercise to any disability that you're facing. Here's some example of free exercise programs. So Can Do MS has MS Moves in the MS Exercise Library. There is a free nonprofit called Darby. They provide daily exercises. There's Keep Moving with Emily, who's an adaptive exercise coach, and she's fantastic. And then there are a few other links that I provided in the slides, which again, you will get these and you can click and explore. But no reason to be paying for an exercise program, right? We all have a lot of bills to pay, and there's a bunch of resources out there. So sleep is so important. And I can and have spoken about this for an hour straight. So by no means am I going to get through everything there is to know about sleep in 2 slides, but here we're going to try. So sleep hygiene is really, really important. So tips in general for optimizing your sleep is create a routine. Go to bed at the same time, wake up at the same time. Try to minimize the stimuli in your room. So that includes light sources, sound, people, pets. Yes, we love our pets, but sometimes they interfere with our sleep. Same thing with our spouses. Room temperature is important, so keeping it nice and cold. And I just sort of tell my family, too bad. It's going to be 66 degrees in here, and you can have an extra blanket, but that's what I need to sleep. MS symptom management is so important. The bladder symptoms, as Derek was saying, if you're getting up to pee 3 times a night, you're not getting good sleep. So you need to talk about that with your provider about managing your bladder frequency. Pain is like pain and spasticity. I think is a symptom I personally have struggled with the most because I will be so exhausted. I'll be laying in bed and then my legs start zinging with that nerve pain, or they start spasming and jumping around and waking me up through the night. And it is the worst feeling. So there are, again, medications that can help with those symptoms that you can take at night. There's also lotion. So there was a 2-week span where I didn't get any sleep, and my husband and I, we went to CVS and I just bought every lotion and potion that I could find and tried them all. And for me, Hemp's with a Z, HEMPZ lotion, I put that on every night and I sleep like a baby. And I've told that to my other friends, my other nurse practitioner friends who have MS and patients. So Hemp's, please sponsor me, but I swear by it. It really, really works. And it can make such a big difference. And that's what I'm talking about with breaking one symptom. And if you manage the bladder, if you manage the spasticity and you get relief, then you're going to get sleep. And I swear it's going to make your life so much better. There are also non-drug strategies, so relaxation and meditation. There are a lot of fantastic podcasts and Spotify and Apple Podcasts and wherever you listen that do relaxation and meditation exercises. So this has become part of my nighttime routine as well. And cognitive behavioral therapy really works for insomnia. Starting a sleep diary, which I have linked an example to a sleep diary here, can really help you understand your triggers and help you improve your habits as well. Naps, a word on naps. They don't replace a good night's sleep. A brief 20 to 30-minute nap can improve your alertness. Longer naps, however, will make you feel more groggy. And you definitely don't want to take a nap in the late afternoon or close to bedtime because it can really mess up your sleep schedule. So naps, pros, cons. Some people are nappers, some people are not. If you're a napper, try to keep it brief. Some things that are red flags. It's hard to tell if we're just tired because of our fatigue or because our sleep. But there are some red flags here that if you have some of these, it might indicate that you have a sleep disorder. Sleep disorders are very common and even more common in MS. So MS patients are known to have more sleep apnea and issues. So if you have excessive daytime drowsiness, you're waking up already tired, you're not feeling rested or refreshed. If your partner's saying you snore like hell at night, you're so loud, if you wake up with these headaches and your throat is sore, then that might indicate that you have sleep apnea and you should get assessed to make sure. Sleep apnea can have many devastating health effects. So if you have these things and this is speaking to you, maybe speak to your doctor and consider seeing a sleep specialist. Also, trouble falling or staying asleep, not because of any of the things that I just described with your legs being jumpy or your bladder keeping you up, but like your mind racing, right? You can't shut your brain off at night, or you wake up at 3 a.m. and your brain's like turning, and you can't fall back asleep. That's usually a telltale sign of depression and anxiety. So if you have depression and anxiety interfering with your sleep, if you address your mood, like Derek mentioned, it can really do wonders to help you sleep better. I see the chat is just popping off and I don't have time to read it, but it looks great. This is my advice. Fatigue is often unavoidable. Most of us live with it to some degree. It's an unavoidable part of life with MS, but that doesn't make you completely powerless against it. So how do you live fully knowing that this is part of your life? I, again, live this every single day. And I've talked about conserving energy. I treat energy like my most precious resource. So I prioritize it. I save my energy through my daily routines, little things throughout the day, because little changes add up to a lot of extra energy throughout the week. If you're struggling to figure out how to prioritize and how to save energy in your day-to-day, speak to your physical therapist, speak to your occupational therapist. They can help you find ways to conserve energy. If you are trying to figure out how to conserve energy at home or at work, OT, oh, they're such a blessing. If you haven't worked with an OT before, they're amazing. I also personally struggle with, if I'm having foot drop or leg weakness, I'm using so much energy just trying to get my body to move and my legs to take me where I need to go. So using an assistive device, something that helps lift your foot, like an AFO, or using a cane, or using a walker or a wheelchair, I think of those as my little energy saving weapons. Because the less I'm physically working to get something done, the more energy, again, I'm conserving to put into something else later in the day. And know your rights. Do not be afraid to ask for workplace accommodations. So I have a heater, an AC, portable, something that helps you control the climate in your office, because they're always either too cold or too hot, and both are bad for us. So it is a completely reasonable and easy thing to ask for some sort of portable device to help you stay at a comfortable temperature. And that alone can be game changing. It was for me. I was having trouble making it through the day at work, and I just got a little AC heater unit, controlled the temperature in my office, and made such a huge difference. Also, use a handicap placard. I don't care where you are, or if you think like you can make it across the parking lot. Again, we're talking about little moments of energy conservation and the difference between walking that much across the parking lot versus parking right near the entrance of the place that you're going to can do wonders. So don't be afraid of the stigma associated with handicap placards. I look completely fine. Nobody has ever come up to me and harassed me. I've heard horror stories about it, and so I get that there's a fear associated with it, but know that your energy is your most precious resource, and you need to use every tool possible to save it. Also, let's talk about life, right? Sometimes you just want to participate in life, and that's okay. And you know that certain things are just going to suck the energy out of you. But a lot of times those things bring you a lot of joy. So that can be going on a vacation, that can be socializing, going to a wedding, going to a party, hanging out with your girlfriends. And you probably realize that doing those things comes with an MS tax, right? My advice is enjoy the moments that matter. This is what makes your life full and happy, but plan ahead to conserve energy, both beforehand and after. I never come back from vacation on a Sunday and go back to work on Monday anymore. My policy is that we return from vacation on Friday, and I have 48 hours to unwind and rest before hitting work on Monday. Same thing on the front end. If you know you're going to be doing something taxing, try to conserve your energy in the day or two beforehand. So just knowing that it's inevitable sometimes, it's worth it. This is your life. You have to live it. And planning for it. That way, when it happens, you're not surprised. You're not depressed about it. You're like, oh man, that was such a great vacation. Can't wait to lay on the couch and do nothing for entire 24 hours. Listen to your body. If you're out and you're unexpectedly feeling like you need to slow down, just know where your limits are, pace yourself, and try to avoid overexertion. It's okay to rest. Rest is not a sign of weakness. It's a tool for maximizing your quality of life. So if somebody gives you grief about why are you being lazy, blah, 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 you know, we've all heard it before. It's okay to say rest is one of the tools I use to manage my MS symptoms. That's all it is, just like a cane, right? If you're feeling depressed or discouraged about your fatigue, definitely consider cognitive behavioral therapy. It can really help you reframe your mindset and manage your symptoms. I can't recommend it enough. And I think that's it. Yes. So now I see we have so many comments and so many questions.
So many good questions. Before we dive into questions, I did just want to mention as a reminder that we would really love for everyone to complete the survey at the end of tonight's program. But like I said, first we're going to get to some questions here. Let me stop sharing my screen so everyone can see all of us well. We have a plethora of questions, you guys, so I want to try to get through as many as possible. But first thing was people had a few questions about sleep tools. So are sleep monitors helpful, and any temperature regulation ideas for sleep to help with sleeping better?
Yep, I crank that thermostat down low as it can go. I have 2 fans on me at all times. My husband says it's like sleeping in a hurricane, and he just has to do it. There's also cooling comforters. So I found a comforter that has vents in it. So I can't sleep. I'm not like, I just can't. I have to be snuggled up in something. But I found this great comforter on Amazon that has vents in it and helps release. There's also like bed fans, all sorts of stuff out there. And again, you all are the experts. There's over 700 of you right now. So drop your personal experience in the chat as well.
I love that. Back to spasms. Stephanie, I know you mentioned the hemp scream. If you do have a specific one that you like, people have been asking for it. So if you want to drop
I
that
don't
in
know, it's
the
the
chat,
blue one.
we'd love
I
it.
don't know.
But if there's any other, tools, medication tricks that you guys have for managing that kind of leg pain, that spasm at night, any thoughts or ideas?
Yeah, Derek, what would you recommend?
Yeah, well, doctors push medications. That's just what we learn in medical school. I don't know. If it's a persistent, painful spasm in the evening when you're trying to get ready for bed, the biggest side effect of muscle relaxer medications is usually it makes you tired. So this is the one scenario where a medicine side effect could be absolutely used to your advantage. And there's not really a one size fits all medications. There's a ton of good ones and there's pros and cons to all of them. But just so I could say the names of them out loud, and maybe you want to ask your neurologist or your neurology team about them. So tizanidine, baclofen, cyclobenzaprine, these ones are all generics, really well established. We understand how they do and what side effects to be on the lookout for, and they work. They absolutely can help with the kind of these nighttime spasms that interfere with your sleep. It can make you more tired the next day.
Yep. I definitely do that. I use my muscle relaxers and amitriptyline at night to help my symptoms, and they make me tired, which is great. So
That's awesome. Thank you guys for sharing that. We had a number of questions about supplements, foods, herbs. Are there any supplements that have been studied or foods and herbs that can help combat fatigue? Any ideas there?
You can go first, Stephanie, if you have some thoughts.
sure, sounds good. I mean, nothing specifically aside from what we've already mentioned with caffeine. The other thing worth talking to your doctor about is B12. So B12 deficiencies are pretty common. B12 can cause numb, tingly feelings in your extremities. It can cause a lack of energy. So simply checking a B12 level, and even if it's on the low side of normal, below 400, often I will recommend supplementing. And a lot of people report that boosts their energy.
Okay.
Right.
Anything to add?
Yeah, no, I mean, I breezed over it on the one slide, and I don't think I did enough justice to it. So, your primary care doctor absolutely should be a part of the story of your MS fatigue. A good neurologist, I think, would also be in tune with things like if your thyroid level's off, that absolutely can cause fatigue, and not just, oh, you have MS. It must be that's causing you fatigue. Thyroid disease is unbelievably common, and its presenting symptom is as often fatigue. So that's a mimicker. Low iron levels. If patients have a bleeding disorder, or if they have really like heavy periods, I know that's a thing that my patients have sometimes. And if their blood level counts go low and they get anemic, they can feel tired from that. And so sometimes going on an iron supplement. There's not a one size fits all answer, but kind of zooming back out and thinking of other causes besides, oh, it's just your MS. My patients get so frustrated when their primary doctors say, "Oh, talk to your neurologist, probably your MS." And then I go, "Well, no, we're going to check your thyroid and we're going to see your iron level." So your primary doctor should be equally as engaged in helping to figure out your fatigue as it starts.
It's awesome. Love that whole care team approach. So I want to talk about something a little bit different here. Changing gears. I want to talk about communicating about your fatigue. So we had some questions about, Derek, do you have any tips for when someone wants to talk to you about fatigue for the first time? Is there a best way to describe your fatigue to your doctor? And then we also have some questions about talking to family and friends about fatigue.
Yeah. So I hate when I'm the first one to bring it up. So and I think I try to role model good behavior because I always have somebody with me. I always have a medical student, I always have a doc in training, and I think they're really good about keeping me honest about uh, keeping the questions going because medical students and docs in training ask lots of questions. And so sometimes I'll hear buzzwords when they've seen the patient and they come and talk to me about it. And then we go see the patient together. That helps me clue in. I need to be good about proactively bringing it up. But if your neurologist doesn't, then ask. It is the most common symptom that MS patients get, and it has tentacles. It takes on all these different ways on which the person experiences it. I don't think you'd be wrong because I've had patients ask me, "Hey, a lot of my other friends that have MS say that they have fatigue. Do I have fatigue? Here's the symptoms I have." And then you guys just figure it out together. Because again, like we just went over for 40 minutes, there is not a one size fits all approach. And there's so many different things that can mimic it and red flags that Stephanie taught us about sleep. And so that's our job to help figure it out with you guys.
Yeah. And I think it's even misconstrued among us, those of us with MS, but fatigue is not the same thing as being tired. So there's a little bit of educating you have to do with your friends and your family, distinguishing between fatigue and just being sleepy. Classic fatigue is not relieved by getting sleep. Sleep is a factor that contributes to your fatigue, but it's not like, I'm so fatigued, if I take a nap, I'm going to snap out of it. So I often describe fatigue as my brain is awake, I'm ready to go, but it feels like I have been encased in cement, and every little movement I do with my body just saps my energy to the point where sometimes even just like brushing my hair or getting off the couch just feels like a daunting task. And that is fatigue, right? So it's this disconnect between the alertness and the energy up here that you have in your brain and what your body is willing to do. And no amount of sleep or rest can really overcome that. So I think the spoon theory is very popular. It's not my personal favorite, but a lot of you have been talking about the spoon theory where, if most normal people get 10 spoons of energy in a day, and they hand out their spoons, and people with MS only start with 4. And so it just takes a lot less to make us tired. But I've seen a couple of you describe your fatigue and how you describe it to people, but I mean, it's a symptom of MS, just like leg weakness. And you explain what it is. You can talk about how Derek taught you. It's because you have cytokines and inflammatory markers, and your body's just working extra, extra hard just to function and get through life. And it's a symptom. It's not something that's controllable through napping and sleeping.
Thank you for sharing. I want to actually ask a question about DMTs. So can DMTs decrease or increase your fatigue at all when you're taking them? Say if you go in for an infusion, anything like that. We had a couple of questions about DMTs and how that can interact with your fatigue.
Yeah, sure. I could take a stab at that one. So Maybe a big fat maybe. So the therapies of MS are not a one size fits all approach when they affect the immune system. Some of them have the potential based on their mechanism to quiet some of that inflammatory cytokines like we were talking about. So if that is a driver of some people's fatigue, then yeah, I sure have seen patients start on some of the infusion-based therapies, and they feel like some of these more subjective, harder to define symptoms feel better. It is not the expectation though. So when we start people on therapy, I absolutely don't say, great news, it's going to treat your fatigue. It is a welcomed bystander effect of some treatments, but it's actually not the main function. We have all these other things that Stephanie and I just unpacked for you guys that we try to use to tackle fatigue, and that the MS disease modifying therapy is trying to prevent new damage from happening.
I will add some MS-DMTs can cause more fatigue. So if you're on an interferon, for instance, and you're getting those side effects after injections, and you're feeling like you're losing days of your life because of that, it's time to talk about switching. Been there, done that. Not again, conserve your energy. Your DMT should not make you feel worse than your MS does. And we have so many options these days that to me, that's unacceptable. I see Derek nodding his head.
Great
Absolutely.
point. Great point.
And then we have other medications like infusions, Tysabri, where you might notice right before your infusion, you have like that drop of energy followed by that like Hulk feeling after you get your infusion. That's, something to consider if it's something that's really interfering with your life. Again, talk to your doctor about how you can manage those and your DMT options. It's also important to know that when you're having a relapse, which are, as Derek said, incredibly rare these days, but still worth mentioning, you're going to be more fatigued during a relapse and for a good 3 to 6 months after, and your energy levels will recover and you will bounce back, but it's normal to feel more fatigued during those periods.
Thank you. So I do want to revisit the stimulants conversation because a number of people commented in the chat about Adderall as well. And I just wanted to, ask you guys if that is a good option. What are you guys' thoughts about the use of Adderall?
Yeah, I can take a step first. So it can help. I don't think it's fair to shy away from it in patients where it could have potential value. It has so many potential side effect risks that we just don't start with it. And it's pretty rare for patients to actually not get benefit on other types of treatment strategies, kind of a mix of all the things we talked about, sometimes including medications that are kind of less than Adderall. But I don't, again, we don't have this stigma in our practice that we don't use Adderall. It is absolutely not for everybody, and it is such a tiny minority that actually need it, which is a good thing. It's like any other medicine, it's good to have it as an option, but we don't start with it, and we often don't need to use it. But there are just some patients, and it's often patients that have pretty like moderate to severe forms of MS. Their poor brain has taken a beating from the disease, that often where that actually is the only thing that could help them. And even then, we stick to the algorithm. We go low, we go slow with the other therapies because they can work and they don't have the same risk benefit ratio that Adderall and medicines like Adderall can have.
Okay, thank you.
Sure.
So this may be a can of worms, but I did want to ask it because again, a few people have asked questions about this. Any thoughts on the use of cannabis to aid with sleep as well?
Never heard of it. What's cannabis? Do you have a strong opinion on this, Stephanie? You're welcome to go first.
I don't. So my general line is that all substances have side effects, right? And we're talking about medications, whether we're talking about cannabis, alcohol, caffeine, they all come with side effects. I'm not a personal fan of using any of those things before sleep because the goal is to get you to the most natural sleep possible. And so whenever we bring up cannabis, I always feel obligated to mention alcohol, right? So if you drink alcohol at night and then try to go to sleep, it's going to affect the quality of sleep you get. So I know cannabis does help people with pain and with spasticity, and really that's the main thing that it's been studied for. But with the big asterisk of it can also affect your cognition. It can interact with medications. So talk to your provider about it.
Yeah, you nailed it. It's a medication like anything else. And there's annoyingly variance state to state and how it's available and what forms and strains and what doses work for what conditions. It's confusing. It's confusing for your doctors too, by the way, because I would rather it just be a medication that Stephanie and I talk to you about in the clinics. We weigh the pros and cons. We have a known treatment strategy, a dose that might help, and we use it. I share the same concerns about disrupting kind of normal sleep-wake cycles. That is by far and away the best treatment for fatigue is good sleep cycle. But if part of what helps you fall asleep is getting your legs to quiet down because they're spasming and they're painful, lots of patients have told me that in Florida anyway, it is medically legal. And the lowest possible dose and the least amount right before bedtime can help in those scenarios, but not as a primary sleep aid. As if it's a nerve pain or muscle spasm problem, then that is a medicine that can help with those in some people.
And please don't smoke it.
That's the worst possible way to use it. Like there's tinctures, there's gummies. Yeah, that's the worst possible way to get it into your body. Agreed.
Awesome. Thanks for that feedback, you guys. We have just a few seconds left here. So I'm going to share my screen again really quick to go through just a couple final slides. I did want to say there's a variety of ways to stay connected with us here at Can Do MS. You can check us out on all of these different platforms. And then next month, so on October 9th, join us for a deeper dive into diet and exercise and recommendations for people with relapsing remitting MS. One last time, I'll thank our sponsors for their support of this program. And again, I want to thank our speakers today. Thank you so much, Stephanie and Derek, for sharing all of your knowledge with us. And most importantly, thank you to our viewers. Thank you for being here and have a great night.